Good morning. Thank you, everyone, for joining us today. My name is Bethany Doherty, and I am a program coordinator for OneOp. It is my pleasure to welcome you to today's session on the role of the charitable food system in addressing nutrition and food security. In case you are joining us for the first time, I would like to give a brief tour of our webinar platform so you can find your way around. Hopefully, you are currently able to view the slides we are sharing. If you are unable to see them or have any other difficulties, please email us at contact@oneop.org for tech support. As many of you have already done, we look forward to having you join us in the chat pod for conversation and questions. Several people have already shared the location they are joining us from today. Please continue to do that if you'd like. To embed the chat pod so you don't miss any links or conversation, simply place your cursor over the shared slides. You will then see a toolbar pop up across the bottom of your screen. From there, click the chat bubble icon. When typing questions or comments, please be sure to select everyone from the response options drop-down menu so everyone can view them in the chat pod. Note that the slides and resources are available for download on the event page for today's session. We will be covering continuing education information at the end of the webinar, so please stay tuned at the end if you're interested in continuing education credits or a certificate of attendance. Closed captioning is available for this webinar. You can turn on the subtitles via the Zoom toolbar. If you need to step away from today's webinar at any time, please note that a recording will be available for review within 48 hours on the event page. Today's webinar is part of OneOp's Nutrition and Food Security series. An estimated 24% of active duty service members and their families are food insecure. Food security is a complex issue, and thus OneOp is offering a series of live and on-demand webinars addressing a variety of food security topics, such as today's webinar. And we will put the link to this series in the chat pod. Thank you for joining us as we continue our partnership with the Defense Department and the U.S. Department of Agriculture to expand the readiness, knowledge, and networks of the professionals supporting our military service members and their families. The views expressed in this presentation do not necessarily reflect the official policy of the Defense Department, U.S. Department of Agriculture, U.S. government, or OneOp. The mention of any entity or product is for informational purposes only. Today, I'm very pleased to introduce our speaker, Dr. Caitlin Caspi. Dr. Caspi is an associate professor at the University of Connecticut Department of Allied Health Sciences. At UConn, she also serves as the Director of Food Insecurity Initiatives at the Red Center for Food Policy and Health, and is the Associate Director of the Institute for Collaboration on Health, Intervention, and Policy. Her research evaluates policies and interventions related to food insecurity, diet quality, and weight outcomes. In her work, she has partnered extensively with charitable food system partners, including food banks and food pantries. She has also led several qualitative and quantitative studies aimed at understanding how social and economic policies affect food insecurity and other health outcomes among households with lower incomes. So I will now turn it over to Dr. Caspi to begin the webinar.
Wow, thanks for having me. I see people tuning in from all across the United States. I'm in Connecticut today, where it's bright and sunny, and I'm happy to be here to talk about my work in the charitable food system and how it relates to food security among military families. I have no disclosures to report today. So today, the learning objectives are to describe how the charitable food system can fill gaps in food needs for households who are facing food insecurity. We're then going to also illustrate examples of resources and approaches and collaborative partnerships that are geared at really changing organizational practices and working at the organizational level to address food insecurity. And then we're also throughout the presentation going to consider the various health and social needs of people who are relying on this charitable food system. So what I'm going to do in our time together today is give a brief overview of the problem of food insecurity in military families. So both kind of the prevalence and the consequences of food insecurity. And then I'll launch into a brief overview of the charitable food system, the nuts and bolts of it, how it operates, and the role the system can play in addressing food insecurity for military families. And then I'm going to walk through 4 different approaches that professionals who are interacting with the system can use to improve the nutritional quality of food and the client experience. So this applies to dietitians, to nutrition educators, and really anyone who's willing to engage at either an individual level or also a systems level within the charitable food system. So the 4 approaches that we'll be going through include nutrition education, how to survey clients to assess their needs and preferences, how to implement nutrition standards within the system, and then how to make the healthy choice the easier choice for clients. Okay, so let's move forward here. Okay, so to kind of level set about the issue of food insecurity and military families, based on a 2023 estimate, about 1 in 5 military households are experiencing food insecurity. And this is notably higher than the overall US prevalence, where we find that in 2023, it was about 1 in 6 or 1 in 7. And among military families, there's a higher prevalence in certain subgroups, including those that are active duty, those that are veterans, those that are junior enlisted service members. And then we also know from research that military families really do face specific risks when compared to the general population. So experiences and conditions can put people at higher risk if they constrain household income. And we know that things like frequent relocations or disability or limited opportunities for spousal employment can do just that. They can constrain household income and financial stability, which is the mechanism by which food insecurity affects households. Now, the consequences of food insecurity are really far-reaching. If this is in the general population, food insecurity can affect both physical health outcomes and mental health outcomes. And it also has effects throughout the entire life course. So we see that in adults, food insecurity is associated with outcomes like diabetes as well as other chronic disease. And then among children, it's associated with iron deficiency anemia. And we also know that food insecurity is associated with overall poorer quality diets. So if we measure using healthy eating index scores, the USDA measure of alignment with the dietary guidelines for Americans, we find that those who are food insecure generally have lower healthy eating index scores compared to those that are food secure. So all of this taken together suggests that there's a need for to offer opportunities for healthy food consumption among those who are experiencing food insecurity. So I do see that the slides have gone away once again. Maybe I'll just keep talking while we get those set up again.
Yes, Dr. Caspi, I apologize. Please
That's okay.
continue and we'll get the slides brought back up.
Sure. Okay, so among military families, there are potentially a different mechanisms and consequences of the effects of food insecurity. So we saw in the research is somewhat limited, but we've seen that food insecurity was associated with intentions to leave their position among military families. Another study suggested that the stress associated with food insecurity was associated with an exacerbation of PTSD. And so again, these are really specific risks. While we know that the consequences are sort of far-reaching in any population, these are particular risks that those that are service members might carry. When we think about the tools that we have at our disposal to address food insecurity, we can really look at a lot of different levels. So what I've put here is what's called the social ecological model. And it's really just a picture of the range of approaches that we have to address food insecurity. So if you look at that bottom level, that individual level, we can think about ways of helping individuals and supporting them by, for example, offering nutrition education programming, increasing food-related skills, budgeting, nutrition knowledge, all of that at the individual level to support people's access to healthy foods and the consumption of healthy foods. Then kind of moving up a level, we can work within the healthcare system, taking action like engaging with the healthcare system to make sure that people are being screened for food insecurity in primary care settings, offering referrals to resources or providing healthcare systems with resources to guide people through the process of, for example, signing up for benefits. And then there's other kinds of institutional initiatives, obviously. Major programs like the school meals program operate in order to address food insecurity among children. And then moving up a level, communities have a role to play in offering healthy environments to support food access for all. And there we're looking at things like the charitable food system and the food retail environment in order to give people access to the food that meets their needs, preferences, and price point. So above and beyond all of this, we have a host of tools at the kind of federal level or a kind of national policy level. We've got these large-scale programs, programs like SNAP and WIC, which are really put into place with the express role of promoting food security within the population. And by and large, those do work, but they don't fill all of the gaps in all of the families. And so what we're trying to do is broadly find ways that we can work at multiple levels. I'm going to anchor my talk today at the community level, really situating it within the charitable food system, but I don't want you to think that I don't see the connections between these levels. It's really clear that the charitable food system does not operate in isolation. It interacts with these federal programs like SNAP. It interacts with nutrition programming that can affect things at the individual level. So in that way, we have to sort of think bigger. Next slide, please. Okay, so here, I just want to give an overview and define some terms that I'll be using throughout the presentation, terms that are related to the charitable food system. You may have heard some of them, but starting with food banks, when we're talking about food banks, we are often talking about kind of the large warehouses. They're places where food is procured and stored and then distributed to food in their partnering agencies. So these are usually regionally based agencies. Each state might have a number of food banks that distribute their food to hundreds of food pantries. And so these food pantries really interact with individuals who are coming to the food pantry to get food. And we have kind of a saying that's kind of everywhere if you're working in this space, which is, if you've been to one food pantry, you've been to one food pantry, meaning that these operate kind of independently. They're not particularly centralized or regulated spaces, which means that there's actually a lot of room for innovation, but it also means that we can't draw conclusions about what this system is like or can offer just based on one specific food pantry. And then the other sort of the other key player in this, of course, is the clients. I'm going to be referring to the people visiting food pantries as clients, but really we can also refer to them as neighbors or friends or guests. That's kind of the range of terms that are most commonly used to describe those that are visiting the food pantries. Now, historically, food pantries, they emerged to fill kind of like short-term emergency food gaps, and they measure their impact in terms of the pounds of food that they distribute. But really recently, I think that in the last 10, mostly about 10 years, there have been a lot of efforts to reimagine these spaces as places where people can obtain food and other services beyond just food, and they can obtain them with dignity. So an example of that is a shift away from providing people with just pre-packed bags. Many food pantries now have moved to a system where people can go in and choose their own food. It's much more like a grocery store. And there's been, if you look at the literature, there have been successful interventions in food pantries where we've seen that if you change things within a food pantry, you can have an effect on clients' health. So we've seen food pantry interventions that have improved food security as well as weight and diabetic control. Next slide, please. So what do we know about the charitable food system use among military families? There's not tons and tons of literature on this, but in 2021, there was an estimate that 13.2% of enlisted military families with an active duty service member relied on charitable food in the last 12 months. Now we know that the prevalence of food insecurity is higher. So it might be that only about half of people experiencing food insecurity are relying on these resources. We also know that some groups had higher usage of food pantries and other charitable food resources, including those with lower pay grades, Army versus Air Force members, as well as those who were older, those who had more dependent children, and those with lower financial well-being. So if we take a step back, we might think that people aren't relying on the charitable food system because there's getting, a lot of other assistance or resources. But, if we use SNAP program participation as an indicator, it suggests that that really people are not getting enough support in this area because SNAP usage tends to be quite low in this population. And this can be due to constrained, or kind of very strict eligibility requirements that are income-based, that many military households do not meet because, for example, the basic housing assistance is included as a form of income, and so they are not eligible. And even beyond these kind of income eligibility limits, there's other reasons that could affect people signing up to participate in SNAP, including a stigma associated with the program or a lack of knowledge about the program. Next slide, please. Okay. So why might we see that families are not relying on the charitable food system, even if they kind of need the support? Well, the system really has some notable challenges. I'm going to kind of describe challenges in both the supply of food as well as the demand for some foods at the food pantry. So if you look at these pictures, you can sort of see a demonstration of constraints in supply. You don't always know when you go to a food pantry what food is going to be on the shelf. And this is a system problem. You can't always get a consistent offering of fresh and large varieties of fresh fruits and vegetables at a food pantry. And then at the same time, when food is available, it might not be displayed in the most appealing way. You can sort of see these meal kits, this picture of these meal kits there that says complete meal kits, only 2 points. But, there could be some whole grains and lean proteins in there, but people have no idea. And they're on this bottom shelf and you don't know how long they've been there. And so if foods are not displayed appealingly, then they might not get taken by clients. And then, that they might not be procured again because there's a perception that people don't want things. So please click ahead. So I wanted to ask if you could reply in the chat. What are some other challenges that you see and reasons why you might have people hesitate before using a food pantry? We've got supply issues, demand issues. What other things do you see? Yeah, I'm seeing a lot about the challenges of transportation and accessibility. I'm seeing stigma. I'm seeing people talk maybe not being having the tools available to prepare food at home. I'm seeing language barriers. Wow, so many ideas here that I think really tell us the wide variety of barriers that people are facing. I see lack of access to culturally appropriate food. Um, and then local pantries, yeah, they often have restrictions on how frequently you can visit the pantry. And they might have hours open that are pretty restricted. They have long wait times. I think, wow, this is the collective knowledge here is really incredible. Thank you for providing all of that. But I think you're right that there's really a lot of reasons why we're seeing relatively low usage compared to the need. Next slide, please. All right, so now I'm going to start to walk through the 4 different approaches for meeting client needs in the charitable food system, including nutrition education, understanding client needs and preferences through surveying, implementing nutrition standards, and making the healthy choice the easy choice. So the first thing I'm going to walk through is nutrition education in the charitable food system. And I will say that among food insecure military families, nutrition education has a high appeal. One study showed that among families with young children, 68% reported being interested in cooking classes. So in some senses, this has a lot of promise as an intervention strategy to address some of the individual level barriers facing those with food insecurity. Now, the first study that I ever led as a researcher was in University of Minnesota, and what we were doing is looking at the effectiveness of doing a nutrition education in a food pantry setting. We worked with 4 food pantries in Minnesota, and we implemented a nutrition education and cooking program, Cooking Matters. And each week the program led a recipe and people could take home those ingredients and make it again at home. We did a visit to a grocery store where people could kind of shop on a budget. And we also offered childcare for people to make it easier for them to show up, and transportation to that weekly meeting as well. And then we evaluated how that affected overall diet quality as measured by the Healthy Eating Index. And so you can see the results of the study here. It was a small study, but we did note that just following the intervention after 6 weeks, there was a statistically significant increase in Healthy Eating Index scores. So this was promising. But then we went back about a month later and we did a follow-up, and scores of Healthy Eating Index had returned to baseline level. So it wasn't really sustained over time. We also noted that it was really challenging for people to get there, that even though we did provide transportation and childcare, to attend a weekly class for adults this is really challenging. And so when you're working at the individual level, one of the issues is that you're putting sort of the onus of change on the individual. And like, while they can learn useful skills, but the potential effectiveness of these approaches could be enhanced by lowering other types of systemic barriers and working again at the organizational level to support some of these changes, as well as increased sustainability. Please advance the slide. Okay, so where does that leave us? It leaves us, I think, in a place where we know that nutrition education can be an important component for addressing healthy food consumption in this population, but at the same time, we need to think beyond that about how to address food needs. And so in 2017, I started a project in conjunction with my community partners in Minnesota in order to better understand client experiences in food pantries and better meet their needs. And at that time, there really wasn't a ton of research in this space. So we sent out a survey to all of the food pantries in Minnesota. We received responses from and we asked them to survey 25 of their clients. And we got responses back from over 4,000 clients and 188 food pantries. And some of the highlights that we learned, first of all, was that people really got a lot of their food from the food pantry when they were clients there. So we found that 53% said they got half or more of their total food from the food pantry, which is really important to note because among these food pantry users, it's really an important source of food. You can think about if we're going to modify what they can take home, that could have a substantial impact on their diet quality. We also heard from people that 90% said they know how to prepare many fruits and vegetables. Again, just reinforcing that people need nutrition education, but they need more than nutrition education to help meet their needs. And then finally, we asked people what the most important foods were to have every time they visited the food pantry. And the foods that people listed here in order were meat, poultry and fish first, and then dairy, then fruits and vegetables, eggs, and cooking items like spices and oils. So these are by and large healthy and staple foods. Notably, even though they were on the list, people weren't checking the box saying that the foods they most wanted visiting the food pantry were mixed meals like macaroni and cheese and ramen and snacks and some of those things that you really see filling up the food bins when you pass by a food drive. Next slide, please. So we repeated the survey in 2019, and we heard from even more clients in over 220 food pantries. And by and large, we saw a lot of consistency in terms of what people were requesting at their visit. And this time we actually also asked people how common it was for them to be able to always find these foods when they visited the food pantry. And there was a lot of variability. Remember, if you've been to one food pantry, you've been to one food pantry. But we found that there was room for improvement. So, for example, only about half of people said that fruits and vegetables were always available. Next slide, please. So the survey was repeated again in 2022, and now I think it's being again collected in 2025. It's now being administered by University of Minnesota Extension. But I want to share some highlights from that 2022 survey about what other elements of the pantry experience people highlighted as important. So beyond like the type of food that they could select, they also talked about certain experiences like being able to choose their own food, that the selection process is easy. There can be these kind of complex point systems for choosing food in pantries, and people really wanted an easier process. They wanted plenty of different food options, speaking to the importance of multiple varieties of food. They wanted staff and volunteers to be welcoming, and they wanted food that looked fresh and appealing. And then we also asked how often these experiences happened when they visited the food pantry. And again, there was a lot of variability, but we found that these experiences did not always occur. Next slide, please. So we also surveyed food pantry managers, and we asked them what kinds of challenges they were facing, because we know that the reason that food pantries don't always supply healthy foods isn't because they don't want to, it's because they themselves are facing barriers to accessing them. And indeed, we were hearing that they were oftentimes limited in what they could procure from the food bank, which is often their main source of food. They also get food through donations and other procurement streams, but if they can't get it from the food bank, that's a real limitation. Next slide. So this initial set of surveys is what led us to start to develop a guide to better understand how to meet the needs of clients. And so this guide that I'm going to talk about for a few minutes now is focused on providing culturally connected foods to participants. And you can find a copy of the guide at this link here, and I encourage you all to browse it. But just broadly, there are 4 steps that we outline in order to meet neighbor needs with culturally connected foods. And the first step is really about giving neighbors a voice. So it's about the organization taking action to kind of open itself up to community input. So offering things like suggestion boxes, something as simple as acknowledging an upcoming cultural holiday, asking what foods people still need after they're visiting the pantry, generally soliciting feedback to know so that the clients know that the managers and the volunteers at the pantry are listening. The second sort of step would be to look into the data that these agencies already collect and see how they can be leveraged to understand client needs without having to have them fill out another lengthy survey. So often food pantries know who they're serving and who they're not serving, but sometimes they don't. They can look at their own data to understand the languages that they serve and the countries of origin of those that they serve, and then take steps to address any gaps in being able to serve those groups. The third step is about a kind of self-assessment to determine their capacity to make change, as well as their resources. So do they have connections with community representatives, or do they not? Do they already offer a client choice model, or do they offer pre-packed bags? So based on this kind of initial self-assessment, they can decide what their priorities are and really be realistic about their capacity for change. And then finally, the importance of partnership in this work cannot be underestimated. You really can't go it alone as a food pantry, and there's a lot of examples of collaborations that can get this work done. You know, I as a partner at a university have been engaged in this work with food pantries, but there's really a lot of other opportunities for partnership as well. Next slide, please. So the guide also walks through types of partnerships that can be involved. This includes community organizations serving cultural groups, religious organizations that can kind of offer an understanding of communities served and their food-related needs, as well as connecting with businesses. So local international food retailers could be really a key partner in this work because they might know where to get sources to source healthy and culturally connected foods in an affordable way. And they might even be able to be a supplier or a donor to a food pantry as well. So if you look through the guide, you'll also see examples of collaborations and other types of resources, and examples of work that is being done at other food banks and food pantries to enhance culturally connected food at other agencies. So I encourage you to look through that. Next slide, please. So the guide has a sample survey and template for reporting results that can be easily downloaded and adapted for a food pantry that wishes to survey their clients. I want to note here that coming up with questions to include in a survey is actually more challenging than you might think. And one reason for that is that in my research with food pantries, we see that people are actually pretty hesitant to voice shortcomings about what they're getting at the food pantry. So, you know, people don't want to be perceived as complaining or ungrateful. So you often get a kind of ceiling effect when you ask people these open-ended questions about what they could be doing better. So you have to get at the questions very carefully. You know, people always want sort of a comprehensive list of foods for people to choose from. But then, of course, the more prescribed you are, the more likely you are to miss groups that might be less visible and more in need of a voice. So we propose these kinds of guiding questions, like what are 3 foods you would like to see more of at the food pantry? Or recognizing that, you know, food pantries are resource constrained spaces. They might not be able to offer everything that people list or suggest. Then you can do a kind of A, B, would you rather mango or papaya, in order to solicit, the foods that are most likely to meet people's preferences. Next slide. So I also want to acknowledge that this project focused on culturally connected foods, but the work to understand the foods that meet client needs doesn't really need to end there. There's lots of other food needs and preferences that we can consider in this space. Can you click one more time? And I have a question there posed. So in the chat, could you respond with what other food needs might be considered in the charitable food system for specific populations that are beyond just cultural differences? Yeah, all kinds of dietary accommodations, allergies, whether things maybe require a can opener or special tools to open, particular health concerns like people who have to be on low sodium diets or low sugar diets, infant food needs. Yes, exactly. So if we click again, you can see some of the ones that we've listed on our survey. Do you have any dietary requirements? People might have a special diet for diabetes or vegetarian or plant-based diets. So they might have particular religious diets, and then again, just preferences and patterns of eating, the way we all have preferences and patterns of eating. Next slide, please. And there should be an image showing up there. Nope, I guess the image is missing, but I'll talk through what that is. So I'm going to transition to a different kind of approach, which is about implementing nutrition standards in food pantries. So when you use nutrition standards, what you're able to do is actually both kind of encourage food pantries to pay attention to the nutritional quality of what they're sourcing and stocking, and also encourage clients to select healthier food. So again, nudge at the organizational level and also nudge at the individual level. So implementing nutrition standards can take many forms. I'm going to talk about nutrition labeling, or assigning foods with different nutrient profiles a different color scheme. This is known as a stoplight system, and stoplight systems for nutrition labeling might be familiar to many of you. There is a system in existence used in military service members' dining facilities called Go for Green. So when service members are in dining facilities, they'll see products that are clearly labeled red, yellow, or green, with green indicating that it's a healthier choice compared to a red. But what I'll be describing is conceptually similar to Go for Green, but using slightly different processes and standards to rank foods into a stoplight system. Next slide, please. So in 2019, I was part of an expert panel commissioned by the Robert Wood Johnson Foundation's Healthy Eating Research Program. And this panel also included representatives from food banks and agencies who are really familiar with how food is procured, in order to design nutrition standards that would really be implementable in this system. So we came up with a stoplight system where foods are labeled choose often, green, choose sometimes yellow, and choose rarely red. So to classify foods, it's a fairly simple system with 2 steps. So the first, the person doing the ranking determines what food category the food is in. One of 11 food categories. It could be a vegetable, a dairy, a mixed dish, or a dessert. And then there are cutoffs for saturated fat and sodium and sugar within each category that are used to designate red, yellow, or green. So the guide is available on the Rudd Center. There is a link here, and I encourage you all to look at it. Next slide, please. So this is an evidence-based tool. I want to just highlight some of the research studies conducted by my colleagues, demonstrating that if you implement ranking systems that are similar to this healthy eating research nutrition guideline system, it can result in better outcomes. So in research studies, we've seen that implementing the system results in healthier food ordered by the food pantry staff, healthier food stocked onto the shelf, and healthier food selected by clients. Next slide. And this is an additional tool that you can rely on that makes it even easier to determine the rank color of a food. So it's available at WellScan. It's developed by my colleague Marlene Schwartz. And if you use the tool, you can simply input the information that you know about the product and it will determine the rank. Next slide. So I'm going to move now to the last approach to improving the environment in food pantries, and I'm going to discuss the Super Shelf project. So this is a project that is near and dear to my heart. It's an initiative that started in Minnesota more than 10 years ago, and the goal was to transform food pantries to make them welcoming spaces to access healthy and appealing food. So over a period of months, the idea was to work with client choice food pantries, kind of behind the scenes, to build a consistent food supply. And then after the food supply was built up, we would do a transformation of this space. And in that space, we would make changes to have the healthy choice be the easier choice for clients. So this initiative was a partnership between many partners in Minnesota. My role on the project was leading the evaluation that tested whether these transformations resulted in a healthier food environment and healthier food selections by clients. Next slide. So this is an example of one of the transformations that we did in the Super Shelf project. You can see the before picture on the left and the after picture on the right. This is the Department of Indian Works in St. Paul, Minnesota. And you'll notice on the left that things are arranged relatively haphazardly. Cans are the first things that people can select when they enter the space. There's a box of saltines there. And then after, you can see there's new shelving that's been put in place. There is branded signage that organizes foods. Fruits and vegetables are the first thing you can choose when you walk in. So first it's these fresh apples and some other produce down below. And then you walk into the canned fruits and vegetables section. Those cans are front and faced, and you may not be able to see it, but the whole grains, so whole grain pasta and whole grain rice is kind of at eye level. And so in the end, you have a space that looks more like a grocery store or a market, and also a space that nudges people to make that healthy choice the easy choice. Next slide, please. So how did this work get done? So on the ground, what was happening? It was really a lot of work, and we had a team of consultants who really led this work, and they were partners with the food pantry, any food pantry that went through this process for months. So here you have a picture of our lead consultant. This is Nora Gordon on the right. And Nora, she trained a sizable group of other consultants who, in the context of this project, were extension educators at University of Minnesota, and they were also SNAP Ed educators. And so they were able to implement this more extensively across Minnesota. This work requires kind of a deep level of commitment of time and resources and partnership. And so I just want to kind of dig in a little bit to how this work actually happened. And I'll ask you guys first, if you can click on the slide, it'll pose a question. So what did Nora do, really? What kind of skill set did she need? What does a consultant need to engage food pantries? Just take a minute to think about that. How do we get this work done, working with organizations? How do you make organizational change? Yeah. Yep. I see cultural humility. I see connecting with clients. I see resources and relationship building. Buy-in from the food pantry and empathy. Yep. Tools like refrigeration, all of these are great. Understanding your community. Yeah. Yeah, these are really great thoughts, and it shows that I think you're familiar with how challenging it can be, and rewarding as well, the deep work that it takes to do this. Next slide, please. I'm going to just outline a few of the sort of ways that Nora worked within the pantries. So first was really establishing readiness for change. So in order to participate, there was a screening process before the consultants could really commit to devoting a whole lot of time and in investing other resources. We had to make sure that the food pantries kind of knew what the level of work that it was going to require. So for example, we've kind of level set that it would probably take about 4 to 6 hours of a month of staff time to devote. And were they already offering client choice? Because that would have been a key first step in engaging in this work. And then also engaging change agents. So Nora worked to give a volunteer training, recognizing that volunteers sometimes kind of are the machines behind getting this work done. So, she did volunteer training and put up a suggestion box and really worked to get buy-in from those volunteers, because without that, it wouldn't happen. She conducted a needs assessment. So one example of that, she did an analysis of where they were spending their food budgets and where dollars could potentially be shifted. She did motivational interviewing, so interviews that aimed to kind of listen to leadership and reflect back to them using reflexive listening on what their goals and priorities were, what motivated them. In the transformation, as someone pointed out, cultural humility was key. So making an effort to really serve clients from various cultural communities and having an open mind about how to meet those needs. And then using a whole host of behavioral economic strategies to set up the food pantry so that clients could, the healthy choice was the easy choice. So for example, restructuring the list of foods that clients were allowed to take. So instead of the first thing being pancake syrup and pancake mix, the first choice is fruits and vegetables. So the pancake syrup is still there, but it's later on down the line. Next slide. So we did an NIH-funded evaluation to determine what kinds of changes were observable following the super shelf intervention. And we had 16 food pantries in this study, 8 intervention and 8 control. But I want to note that this was taking place during the pandemic. So we actually could not collect follow-up data in 5 of the sites due to COVID. So this was a limited evaluation. And overall, we did not see significant changes between the intervention and the control group in the nutritional quality of the inventory provided, in the nutritional quality of the client carts, so what they were selecting, and in their dietary patterns based on 24-hour dietary recalls. And there's a lot of reasons that we can think about that could explain this, but it is really hard to demonstrate these kinds of changes, particularly in a small number of food pantries that we had participating in this study. Next slide. So what do we take away from this? I wanted to share that we also conducted interviews with the food pantry managers and clients and had just some really positive feedback saying that the food pantry was a nicer space for them to be in. They were reporting that clients were pleased with what was available. We heard things like the clients are happier, people are more content with making their choices, and they can plan that meal out as they pick the things out. And we also found in our surveys that people in the intervention group were more likely to report that they're pleased with the options of food available after the super shelf intervention compared to the control group. And so what I think we found is that we didn't see evidence that this changed behavior, but that it was very well received by staff and volunteers and clients indicated in other ways. And another indicator of this is that 40 and I think close to 50 food pantries in Minnesota have now transformed. according to this this food transformation model. And they continue to be requests and transformations given the positive experience that people are having with this transformations. So next slide, please. So just to kind of wrap up, I want to recognize that working with charitable food agencies, we need to put a lot of different pieces together. There's not just one approach. We started with that social ecological model that recognizes that there's factors at multiple levels that can shape health behavior and health outcomes. And so there might be merit to really combining these approaches. And these approaches can really complement each other. So it's not just one approach versus the other. And so I want to take that a little further and recognize that these charitable food agencies are part of a bigger system. And in working with charitable food agencies, you're also engaging with the larger food system. So as practitioners and educators and dietitians, there's really a lot of different places to plug in. So I'm just mentioning a few other sort of ways that the charitable food system is relevant and that efforts that can be made that I haven't talked about yet. So one is that helping food pantries to get healthier food through donations. So food pantries rely a lot on donations. And there is actually a guide for healthy food donation that's based on the same nutrition guidelines for the charitable food that the healthy eating research team put together. And so, you can play a role in making sure that those food drives are not just business as usual and that they're really gathering the items that are going to be most useful for the food pantry and the healthiest for clients. Second is sort of recognizing that, SNAP is the government's first line of defense against food insecurity, and it does work. And that, efforts to promote SNAP and enroll eligible people in SNAP are going to help people out in addition to visiting the food pantry, so that these are support systems that can work hand in hand or in tandem. A newer phenomenon that I want to mention that I've seen is these communities of practice sprouting up. So agencies are collaborating, they're working together, and they're getting together every once in a while, on a bi-weekly basis or something like that, to support each other in making changes. And this could be sort of overseen or facilitated by, say, a SNAP Ed educator or extension workers in some states to be that bridge between charitable food agencies. And then finally, I just want to recognize again that food insecurity is primarily an economic condition of a household. So any opportunities to support financial stability, working with social services, housing initiatives, and offering more than just food once you have people at the pantry, clothing drives, benefit sign-ups, all of these things is likely to increase the impact of these critical organizations. And I'll stop there. And I'd like to open it up for questions. Thank you.
Thank you, Dr. Caspi, for this great presentation, and for all of you for being patient with our technical difficulties earlier. We really appreciate you being here today, and we appreciate Dr. Caspi sharing her expertise with us. We do have time for one or two questions. So Dr. Caspi, one question came in that asks, was there any increase in the number of clients participating after the super shelf intervention?
That's a great question. And I think the short answer is that we can't really measure that because our baseline was kind of before COVID, and then the follow-up was before COVID or interacting with COVID. And so distribution models changed during COVID, and we know that the needs went up. Right. And then they kind of stayed high for so long, and they're still so high. So I don't think we can say that the super shelf intervention caused people to visit more the food pantry. Was there kind of a word of mouth effect, kind of informally? It's possible. It's possible that people were going to a food pantry nearer them rather than kind of seeking out another one once they had a super shelf near them. So the word might have been getting getting out, but we didn't test for that specifically. And we didn't see any, observable evidence of that in the study.
Thank you for clarifying. We are running a little close on time, so I'm going to explain the continuing education process. But Dr. Caspi, as you see any questions in the chat, please feel free to engage there as you're able. OneOp would like to invite you all to our next webinar on March 27th, titled Strengthening Food Security and Nutrition Readiness in the Force. This is a roundtable webinar that will highlight specific food security strategies implemented at Fort Campbell, Fort Drum, and Fort Bragg. And we'll put the registration link to this webinar in the chat pod. We would also like to invite you to our spring and summer 2025 webinar series on nutrition for the tactical athlete. So tactical athletes are military personnel, police, firefighters, and first responders. And these webinars will focus on energy drinks, dietary supplements, and operation supplement safety, social drivers of health for tactical athletes, special operations nutrition, and combat feeding. So we will put the link to that series in the chat pod for you to register for those webinars as they come up. For today's webinar, one continuing education credit is available from the Commission on Dietetic Registration, the American Association for Family and Consumer Sciences, the National Commission for Health Education Credentialing, the Association for Financial Counseling and Planning Education, and the Center for Financial Certifications. Certificates of attendance are also available. A link to the webinar evaluation and to receive your continuing education certificate is being placed in the chat. And you can also visit the webinar event page to obtain your certificate. On the event page, you will find the purple continuing education button, and you'll click on that button and you'll be directed to complete the evaluation. After completing the evaluation, you will be directed to select the appropriate CE opportunity, complete a post-test, and fill in your name and email. Your certificate will be emailed to you. Please note that some email addresses will direct the certificate to the spam folder, so please check there if you do not receive your certificate. If you have any questions about your certificate, please contact us at the email listed on the slide, ce@oneop.org. A recording of today's session will be archived within 48 hours to the YouTube channel, which you can access via the event page. Be sure to visit us at our website, oneop.org, to explore upcoming events, articles, resources, and more. You can also find us on Facebook, Twitter, LinkedIn, and YouTube. We will hang around for a few more moments for those who might need to grab any links or information from the chat. Again, thank you all for attending today. Thank you, Dr. Caspi, for this great presentation, and we hope to see you at the next webinar in March.
Thanks so much for having me.